Good afternoon. Welcome. Thank you for joining us today. My name is Sean Evans with the Meridian Chamber of Commerce. And the Meridian Chamber of Commerce, in partnership with the City of Meridian, the Central District Health, Crush the Curve Idaho, and numerous partner organizations and individuals, are proud to share with you a program that will assist Meridian businesses as they reopen. Our campaign is designed to educate businesses on the basic guidelines to reopen based on the Central District Health and CDC guidelines. It will allow businesses to demonstrate to the public that they are doing so in a manner that will keep Meridian healthy and open for business. Online and speaking with us today are just a few of the partners and organizations that have helped develop this program to support the Meridian business community, as well as local business leaders leading in the best practices when it comes to safely reopening. On our call today, we have Amber Evans, Program Manager with Central District Health. We have Amy Stahl with Saucer Health and Crush the Curve Idaho. And we have Danae Valle with V3 Hair Studio.
Hello.
Hello.
We will open it up for questions at the end of the presentations. You can enter your questions at any time during the presentation in the question window. The premise behind our campaign was getting businesses back open and restarting our economy. And this is why our group was started. We initially pursued efforts to get everyone open as early as possible. But we also saw the bigger issue of businesses might face when reopening amidst the COVID-19 crisis. And that was, will the public return to the stores or establishments when they reopen? We're contacted daily by our business members on how the governor's plan applies to their business. When can I actually open? And what guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on the plan or the recommended guidelines, we are here to help the Meridian businesses understand them better. The last thing we want to happen as local businesses is that they go to the effort and expense to open, bring back their employees, restock their shelves, and the public, the consumers, not visit their establishment out of fear or concern for their safety. The Central District Health and CDC have developed some guidelines to reduce your risk out in public, and if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public and safety and health, then that will build the consumer confidence necessary to restart our economy. The Meridian Chamber of Commerce has launched Keep Meridian Healthy and Open for Business to help our businesses build that consumer confidence. As businesses open, according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars like this one that will provide information from the Central District Health and the CDC on the basic guidelines for that industry. The webinar also features local business leaders that have taken even further steps to ensure that they're reopening in a safe and responsible way. After the business participates in the webinar for their industry, they'll be provided free of charge collateral material that can display in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. These items include door stickers that show they're a part of the campaign. It includes posters that they can use if they would like, that kind of shows the steps that they're doing in their store to keep their employees and their customers safe and healthy. Also includes social media materials that they can share out to demonstrate that they're a part of the campaign. And we will be listing them on the website and as being a part of our marketing campaign for this program. This program goes beyond what some other communities are doing in just creating a list of businesses that are compliant. We are helping them understand what it means for their business and sharing best practices from other industry-specific leaders. The guidelines out there are not one-size-fits-all solution for every business. We don't know what we don't know. These industry-specific webinars seek to educate beyond a sheet of written guidelines. Educating businesses on these additional protocols they can implement for their specific type of business is where the value comes in, and that value is the safety for employees and customers. To ensure that we're in compliance with the 4-stage plan that the governor has put out, businesses will only be provided the collateral materials when their business is scheduled to open according to the plan. As a follow-up, after this, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments from their patrons returning to the stores and businesses. This will assist us in phase 2 of our program as we build out the business revitalization team to support area small businesses. Look to keepmeridianhealthy.org website for the full schedule of industry-specific webinars and watch replays of previous webinars. With that, I'd like to turn it over to Amber Evans with the Central District Health to share a little bit about salons, parlors, hair, nail, tanning, and beauty establishments. Amber, take it away.
Thank you so much, Sean. Today I'm representing Central District Health, and I just want to go over some of the recommended actions that we here at Central District Health have put talked about how they can continue to maintain the rules pertaining to safety and sanitation through the Idaho Barber and Cosmetology Service Licensing Board. We also appreciate that Sean Evans and the City of Meridian's board is providing these notifications, because we do like to have you post notifications for the clients and staff about how the business is taking the necessary steps and precautions once it reopens. We want you to communicate with your clients about the updated policies and procedures about cleaning and disinfecting and safety. We actually have an entire document available for saloons, barbers, and spas available through Central District Health that has all of our recommendations. What we're really focusing on is making sure that we're keeping people safe. And with those smaller businesses, I know with salons, you are very close together, especially with barber shops too, that we're recommending maybe possibly having clients wait in their cars before they come in for their appointments so that you have a chance to clean in between. And we're also talking about possibly having these appointments happen in shifts, so each person has an opportunity to still have their business. We're also talking about training your employees in the new protocols and procedures, making sure that they're cleaning the high touch surfaces, that they're not coming in while they're sick, and also making sure that if you have things such as a makeup counter, you're only using disposable applicants that you are distributing individually. If you're using tools and utensils that are disinfected in the back, try to leave them in a disaffected container or plastic bag that's sealed and will not be opened until your client arrives. And we also have like sample protocols about letting your clients know, like when they come in, like you'll have to wash your hands, that you'll be asking them to wear masks. Is all up to the businesses to decide the best practices, but we do have our recommendations available through our website. All right. Would you like me to go more in depth, Sean?
Hold please. For some reason he's coming back on. He's
okay.
muted.
Sorry about that.
Sorry,
Amber, yeah, if you would just stay on the line so that we could ask some questions later.
Absolutely, I'll be here.
All right, excellent. Next, while not required at this time for employees to return to work, one of the most important factors that's been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk briefly about the availability of testing in the Treasure Valley is Amy Stahl with Salzer Health and representing Crush the Curve, Idaho. Amy?
Thank you, Sean. As Sean mentioned, I am with Salzer Health. We are a medical partner with the Crush the Curve initiative, which I'll explain in a moment. I did want to commend the Chamber for your work on behalf of various industries within the city to help educate people on how to reopen safely and protect the health of both your employees and the community. So thank you for your efforts to promote Keep Meridian healthy and open for business. As the medical partner for Crush the Curve Idaho, Salzer Health is responsible for doing the testing, which I'll explain shortly. At our temporary location at the 10-mile crossing development, it's a 10-mile on the freeway. You may have seen large tents. We've been there doing testing now for several weeks. Salzer Health also does testing at our 2 urgent care clinics in North and South Nampa. But more specifically, I'll talk a little bit about Crush the Curve and the tests that we're doing, the cost and the availability. The first test we've all heard about now for weeks is the COVID PCR nasal swab test. That is offered for both symptomatic and asymptomatic individuals. We provide the results of those tests on a patient portal, which is a secure portal accessible to you on a mobile device or your desktop. The second test is called the IgG antibody test, and that is a simple blood test done at the 10 Mile facility. It is a partnership with the University of Washington. We send the samples to Washington and we get the results back in 2 to 5 days. Once again, the results are posted on the secure patient portal for access by individuals. The cost and the overall effort, if you find that you're interested in being part of this large data collection process, just to reiterate that the antibody test in particular is a point in time that indicates if somebody has had COVID-19 several weeks prior, but it doesn't suggest that you have immunity. It's merely a point in time test, and is helpful in getting our state back to work by providing more information about who has been exposed to COVID-19. That is, as I mentioned, it's done at 10 Mile. There is a cost associated with both tests, $95 for the COVID-19 test, $100 for the IgG antibody testing. We do work directly with you to bill insurance, but any unreimbursed costs will be invoiced to your business if you choose to have your employees tested. So that's something to be aware of from a budgeting standpoint. If you are interested in having your employees tested, we're working directly with people through the crushthecurveidaho.com website. There is a form to fill out, and Seltzer Health will be happy to respond to you and work with you. If you have any questions, I'm happy to take them at the end of the webinar. Thank you.
Thank you, Amy. Appreciate that. Meridian is home to some of the most creative and successful businesses in Idaho. These webinars help bring everyone together to share what they're doing in their respective industries to reopen in a safe and healthy manner. These businesses are implementing some of the best practices and are willing to share with keep Meridian healthy and open for business. Please welcome Danae Valle with V3 Hair Studios. Danae, if you want to share with us some of the things that you've implemented, and just to give you a little shout out, I understand some of your protocols have been adopted from the state level. So thank you for joining us today.
Thank you for having me. So this is an industry that I love so much. I've been in it for 33 years, and it's interesting because over the years we've had associations developed to help stylists. Currently, there was not an agency, and there were things going on within our state board. There were some changes, so we found ourselves kind of being able to pull together. So it's been exciting to work with some other stylists and tap into the resources in our community. We did work with Central District Health, Department of Health and Welfare. We've worked with also the City Council, as well as the Chamber and the Mayor, and it's been really neat to feel united. It's a career that I feel there's a high level of potential and influence. So I'm really happy to be able to be here and help mentor other salons. So some of the things that there's a great site on the Rebound Idaho. I'm going to there's so many notes I'm going to kind of reflect back and make sure I'm covering them. But reboundidaho.gov has a specific area for you to go to salons. Every salon is so unique and individual. There's now kind of different scenarios. There's individual booth rooms as well as salons. So for my salon, we actually have 8 stations. Fortunately, we're completely socially distanced. So one of the things that we try to do is we try to look at this perspective as an owner, also as a client, and also as a service provider, so that we kind of have different takes on it. And that's something that in the state's protocol they also talk about. So for our clients, some of the things that we're doing is with the waiting room, we're also making sure that we actually pretty much taken out our waiting room, and so we will have clients text. Fortunately, we have an extra employee that can help us monitor our door, but if not, you need to have them text so that you're not having an abundance of people coming out, so you can limit the amount of people that are in your salon. The other thing we did in our waiting room was just remove everything that's not essential. So we took out magazines and also have limited our there's not a customer's coffee bar that they can serve from. It's kind of hard to serve drinks when people are wearing masks anyway, but we've also asked for our guests to limit the amount of things they bring in. So it's just their essentials, to leave their coats in their car, and we're just trying to eliminate anything extra coming in and out. We have one service provider per station. In our setting, it's a little bit different because I work with assistants, but we're making sure that one person stays per station. We are limiting some of our services too, so waxing and some of the face-to-face, very close face-to-face services are recommended to be backed up on, so like no eyelash extensions. And there are some things that you could do possibly, like face shields, but really consider that. We're having our employees wear face masks as well as our guests. If they don't have a mask, we ordered hundreds of extras so that we can have them available for a few dollars to purchase. I know that our industry is probably one of the most prepared for this. We're already trained. I believe it's 90 hours that we spend specifically on disease control. And so all we're doing is stepping it up. There's a great list that I'd recommend to anyone, and I don't know, maybe a couple of these we could put the links. But Barbicide is a disinfectant that we use. We also use another one called Cavicide, and they have a whole protocol of everything that they are recommending to do for sanitization. Like I said, we have about 6 people. We have one specific employee coming in just to do sanitization, so she can keep up on the towels and cleaning every station constantly. We also did signage that says this station has been sanitized, so every time that is cleaned, we'll be able to post our signage. At our door, we purchased the Central District Help sign, so we have those throughout, but we have them all on the front door. As our clients come in, we are having them sanitize their hands or wash their hands. But there's a local company, Airmaster, that actually is producing hand sanitizer. So we were able to get a great big case of that from a local company, which was exciting for me. Another thing that we have done is we revamped our website. So we're in the middle of having our protocol there so people can go to that if they have a question. But we are texting our protocol to our clients so that they can respond. And the questions that we're asking them are it's not a crazy big text, but it does tell them how anxious and excited we are to see them again, because a lot of people, we need to keep them comfortable. One of the things that I have learned over the time with this career is this is a healing time. We want them to still feel the level of the pampering and the things that they need to do. So in our text, we do let them know how much we're grateful to see them again, but we also make them feel safe. We ask them if they've been exposed to been exposed to anybody who might have the virus. We ask them if they have had a fever. We don't want anything over 98.5, although I've heard 100.4 is what is considered over. You might be able to pipe in there from Central District Health, but I heard that earlier on the webinar a couple different times. And the other thing is if they're waiting for results for a test. We do point out that we want them to wash or sanitize their hands when they come in. Right now, we're actually currently not blow drying hair because of the airborne pathogens that could come in. So that's something in our salon that was recommended to us. I'm part of a nationwide business association, and that is something that a lot of the salons are doing right now. We do have our door monitored. We aren't taking any walk-ins. Let's see, what are some of the other really important things? Oh, as far as checking and tracking temperature, we do have a touchless thermometer, especially for our staff. And there's an app that Kristen Armstrong mentioned earlier called Kinza. So I'd either keep a spreadsheet or an app so that we can keep temperatures. And that's something that's really takes 2 seconds to do for your guest. And I think it will add a lot of reassurance for them. Other than that, I think the hardest thing as a hairdresser is not to hug our clients and stuff. So we're just kind of learning to do a little air hug and send our love to them. But I think that those are the main things that I can think of, other than the fact that we're already trained. So if you haven't been remembering to change tapes between each person, washing your hands, don't reuse your gloves. That's worse than just dirty hands, in my opinion. And if you have employees, if they're sick, have a protocol, have them stay home, and just don't take any chance on that. Anyway, I think those are some of the main things. I can't even say how excited I am to have our guests back into the salon and to hear the joy that's already coming from them. So excited.
Excellent. Danae, are you looking at any, when you will reopen, are you opening full hours as you were before? What measures, what steps are you taking as far as hours to handle the workload that everyone has now been almost 8 weeks without
Yes.
being able to go to their salons?
We'll be working, so different salons are different. So like I said, we have plenty of hours. I do have friends that have up to like 30 employees. So they're triple shifting. They're doing 3 shifts a day, 7 days a week. But I think it's super important also to watch our health, to make sure we're having enough sleep and balancing our stress. There's an extra level of stress with this. So it's important that those that are healthy stay healthy. We will, however, be working 6 days a week for the beginning. We have right now, I believe we'd canceled 1,900 appointments and have a waiting list of over 500 people. So we're working like strategically trying to figure out, because whatever we do now reflects what happens for the rest of our year. So we had just put our schedule in and we're feeling really organized. So we're just trying to track and yeah, and people are really patient, but once again, they're all really ready. So.
Okay, excellent. Amber, coming back to you real quick, can you confirm that guidance on the temperature, if you are kind of monitoring employees or staff? Is there a specific temperature to look for?
Yes, let me pull it up for the specific temperature that you're looking for. With this one, you are looking for anything over 100.4 is what we have through the CDC's recommendations. And so that is like, if any fever over 100 degrees, that is when we start to worry about it being the COVID-19. If it's 96.8 to 100 degrees, it could just be that your body temperature is warmed up. It is 86 degrees outside, so we have to keep that in mind, that people are sometimes a little warm when they come in, but anything over 100 degrees, that is when we really need to start to be concerned.
Okay. Amber, is there any specific services offered by these studios or barbershops and things like that the Central District Health is maybe given some other guidance on?
So far, we have kept all our spas, salons, and barbershops under the same things. We know that all of these people, these estheticians, these hairdressers, these barbers, they take their job very seriously. And like Danae said, they do take 90 hours worth of training for disease control. So we are confident in their ability to sanitize and keep their clients safe. What we are recognizing is, like she mentioned, things like eyelash extensions or eyebrow waxing or some of the more intensive face-to-face things. She made the great recommendation of wearing a face mask. That is something we look at. If you are doing eyelash extensions, you wear a mask, but also the client that you're working with, wear a mask also. Also during that time, make sure you're not like reusing gloves, like she said, because that is it's easier just to buy new gloves. Don't take the risk, because bodily fluids is one way that COVID-19 can spread, especially the mucous membranes, which are like eyes, nose, mouth. It's droplet based, so you need to be very careful about those things. So what we're really focusing on is sterilization, making sure the tools that they're using, whether it's with the barbicide or if they're using a different solution, and also just making the best practices. Like, what would you want if you go into this situation? Would you want the person wearing a mask and you also wearing a mask to keep yourself safe?
Okay, excellent. With that, I want to just remind everyone that we do have it open for questions. So if you do have a question, you can type it in the chat window and we'll address those. But honestly think Amber and Danae have covered almost all of the things. It does sound like this industry is probably the most prepared to open back up in light of what we're dealing with. So let's give it a moment here for questions. Yes, go ahead.
One more thing I was thinking of is that so often we're actually working with our clients behind. So we're not face to face other than pretty much shampooing or a little consultation. So that's also something that I think is really reassuring, is there isn't really as much face to face time as the stylist, but there are others that are, like you said, are going to have to worry, be more concerned about that masking face to face. So.
Okay, excellent. I don't see any questions. So I would just like to once again thank you all for joining us today, and please help spread the word to all Meridian businesses that we're here to help them open in a safe and responsible way and want to keep Meridian healthy and open for business. Be sure to answer the follow-up survey we'll be sending you so that your collateral materials will be available starting today. Visit keepmeridianhealthy.org for more information on this program and to sign up for future webinars. Have a wonderful week and keep Meridian healthy and open for business. Thank you all.
Thanks, Sean.
Thank you, Sean.
Thank you.